Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about how we help children who suffer from depression at our clinic. Unfortunately, depression is not uncommon in children. We believe that childhood is a happy, carefree time, and what do children have to be depressed about? But 10 to 15% of children suffer from depression, and almost 50% of children with learning difficulties have depression, according to some studies. So what do we do at the clinic? We keep an open mind. We gather information from the child, the parents, and teachers. Talking to a depressed child or a teen is not easy. You have to have sensitivity, you have to be careful. Provide a child with a warm, caring environment so they can freely express themselves. We use toys, we can use drawings, we can use storytelling. Sometimes I even sit under the table with a child who is too upset to really sit across a table and talk to an adult. Identifying a child's emotional status is done through rating scales, behavior rating scales, which are filled up by the parents and teachers, by the Beck-Youth scales, which are filled up by the child, often with the examiner asking questions in a gentle way. Sometimes kids are too young or too defensive and they are unable to talk about their feelings, and that is the time when I use the apperception test known as CAT or Children's Apperception Test or TAT, Thematic Apperception Test. After a thorough assessment, we do look, and during a thorough assessment, we also identify environmental factors, the child's interrelationship with friends, family, and teachers, the child's academic performance, and maybe difficulties he may or she may experience in school. Once all that has been done and a comprehensive diagnosis is made, then therapy is started. The therapy started with the child, with parents, and even with school-related conditions. With the child, we provide a very warm, caring atmosphere. We teach them to recognize feelings, differentiate positive from negative or pleasant from unpleasant feelings, and let them know that all feelings are okay. It's okay to be jealous, it's okay to be angry. And then we teach them how to respond to those. So first important thing is to recognize and accept those feelings, express them to an adult or someone, and then to learn to deal with them. Dealing with them initially, of course, requires relaxation so that they don't react. So a child is angry, they don't react in a bad way. We also talk about self-esteem, and the younger children are shown the Green Monster book where inner critical thoughts are dampened and the child is taught to look at positive things and self-worth. Problem solving is also very important, and the link between thoughts, feelings, and behavior is also emphasized. Parent skills include special time. So the main thing is enhancing parent-child interaction. What happens is when a child is depressed, they have very negative behavior, and this incites negative behavior in the others. So parents are taught about that. They are taught how to give special time and active listening and things like that. School involvement is more in terms of identifying bullying or curbing any kind of bullying and increasing assertiveness training. And of course, if there are any academic problems, then solving those. Finally, medication is advocated when needed. We start with the smallest effective dose with appropriate supervision. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.